Before we begin, I would request everyone to please turn on their camera throughout the video conference. Keep yourself mute and unmute yourself only when your turn comes. I hope we have gone live, so can we begin? Jaya, should we start?
Yes, we can begin.
Greetings. I am Kritika, PMU State Coordinator, Ministry of Social Justice and Empowerment, Government of India. As the moderator of today's session, I extend a warm welcome to all the panelists from the state level coordinating agencies of different states who have been constantly committed to the mass movement against menace of substance use under the umbrella of Nasha Mukt Bharat Abhiyan. Drug and substance use is a serious problem adversely affecting the social fabric of the country. Addiction to drugs not only affects the individual's health, but also disrupts their families and the whole society. In order to tackle the problem of addiction in 2020, the Ministry of Social Justice and Empowerment, Government of India, as the nodal ministry for drug demand reduction, launched Nasha Mukt Bharat Abhiyan, which has been extended to all the districts of the country and has transformed into a Jan Andolan. The commitment of the stakeholders towards NMBA has led to a massive public outreach of 11.19 plus crore people, including 3.54 plus crore youth, 2.35 plus crore women, 3.39 plus lakh educational institutions, and 9,000 plus master volunteers against drug use across the country. Today, we are glad to welcome all the respected panelists and the audience connected with us in the national level panel discussion on innovation in action, strategies adopted by state level coordinating agency, which is being conducted as a part of a number of online events under the aegis of Nasha Mukt Bharat Abhiyan to celebrate our 78th Independence Day through discussions on various themes around substance use prevention with different stakeholders. To showcase the innovative actions and strategies adopted by SLCAs, we have with us today Dr. Sandeep Hanse, Chief Functionary, and Ms. Anamriya Barua, Project Coordinator, Committee on Socio-Economic and Health Development, SLCA Assam and Meghalaya, Ms. Manisha Sharma, Director, and Mr. Saurabh Tiwari, State Coordinator, Sankalp Sanskritik Samiti, SLCA Chhattisgarh. On behalf of Mr. Jitendra Bhai N. Amin, Secretary, we have with us Mr. Tonmoy Chatterjee, State Coordinator, Nashabandi Mandal, SLCA Gujarat, Mr. Sandeep Parmar, Executive Director, Gunjan Organization for Community Development, SLCA Himachal Pradesh and Chandigarh, Mr. Giju Varghese, Director and Secretary, Changanacheri Social Service Society, SLCA Kerala, and Dr. Rajesh Kumar, Executive Director, Society for Promotion of Youth and Masses, SLCA Delhi. We are glad to have you all on board today. Your supervision and guidance has helped in an effective performance of SLCA in your states as a facilitating body between the central and state level, which has played a vital role in a smooth conduction of the activities under Nasha Bharat Abhiyan. Moving forward, to share the achievements and progress of the Abhiyan, I would request my colleague Kristu Raj, PMU State Coordinator, to share some highlights of the Abhiyan with a short presentation.
Let us go through the journey of the flagship Nasha Mukt Bharat Abhiyan so far. Article 47 of the Constitution directs the state to prohibit consumptions of intoxicating drinks and drugs which are injurious to health. A survey conducted by Ministry has revealed that there are 7.3 crore substance users out of 58 lakh are women and 1.2 crore are children. That demand reduction focuses on primary prevention, treatment and reintegration in the society. NAPTDR focuses on generating awareness, reducing stigmatization, training and campaigns and rehabilitation. The flagship Nasha Mukt Bharat Abhiyan under NAPTDR was launched on 15th August 2020 in 272 vulnerable districts. However, By 15th August 2023, the Abhiyan has reached to every district of India. Objectives are awareness generation, substance-free institution, community outreach, rehabilitation, capacity building, and overall well-being. The implementation strategy of the Abhiyan works on three-pronged approach: supply cut by Narcotics Control Bureau, outreach, awareness, and demand reduction by Ministry of Social Justice and Empowerment, and treatment facilities. NMBA implementation structure has ministry at the center, followed by state level and district level committees. State level NMBA committee have organized meetings and there are some glimpses. Master volunteers are the special component of the campaign. We currently have volunteers and the number is increasing. The selected master volunteers have been trained through material developed by the ministry. NMBA has reached out to 11 plus crore people. This includes 2.3 crore women, self-help groups, and Mahila Mandals against substance use, 3.5 crore youth through youth clubs and Yuva Mandals, 3.35 educational institutions to form drug-free clubs. Traditional and indigenous art forms through Mukut Nadak and local folks have been extensively in communities. Hotspots are critical to be identified. Youth and community champions need to be trained to take the initiative again. Some glimpse from NMB interaction with NCC cadet addressed by Honorable Defence Minister. Oath-taking ceremonies have been organized across India by state and district officials in educational institutions to encourage students to lead a drug-free life. Various religious organizations promoted the campaign through yoga, mass awareness, and counseling therapies. An NMBA mobile app has been launched to collect the activities from master volunteers, district and state officials. Its unique feature is present the real-time data of the activities. NMB website also has a pool of all resources, expert forum, pledge, and citizens corner. A 24/7 active national de-addiction helpline 1446 is a toll-free number that provides primary counseling and refer all to nearest de-addiction center. NMB has social media handles at various platforms to update the activities and upcoming events. Youth has been engaged through positive use of social media also. Online activities are being organized such as quiz, essay competition, panel discussion, culture event. This program is also a part of it. Panel discussions with the subject matter expert and monthly newsletter is also released. Kapas is online platform which has 12 modules on awareness, symptoms, management, and prevention. It is free course available on our website. Mission Navachetana is school-based program where students, parents, teachers are trained on drug dependence and coping strategies on topics such as healthy living, drugs, peer pressure, emotions, and violence. Now coming to treatment rehabilitation part. NAPTDR has 582 granting aid institutions and more than 3.8 lakh is the yearly reach of beneficiaries. Integrated Rehabilitation Center follow a 30-day inpatient model. Addiction treatment facilities are set up at government hospitals and district de-addiction centers are comprehensive, which includes all facilities at one place. De-addiction facilities provide primary screening, medical, counseling and therapy, recreation and follow-up activities. Community peer-led intervention focuses on adolescents and youth to train them as peer educators, facilitating behavior changes. Outreach and drop-in centers are OPD facility for screening, assessment, and referral with treatment facility. Granting aid institutions have been geotagged all across India. Honorable Prime Minister Narendra Modi ji also talked about Nasha Mukta Bharat Abhiyan in 103rd Man Ki Baat program. Let us hear and end with this.
म्यूजिकल नाइट्स हो, हाई एल्टीट्यूड में बाइक रैलीज हो, चंडीगढ़ के लोकल क्लब हो और पंजाब में ढेर सारे स्पोर्ट्स ग्रुप्स हो, ये सुनकर लगता है एंटरटेनमेंट की बात हो रही है, एडवेंचर की बात हो रही है, लेकिन बात कुछ और है। ये आयोजन एक कॉमन कॉज से भी जुड़ा हुआ है और ये कॉमन कॉज है ड्रग्स के खिलाफ जागरूकता अभियान। जम्मू कश्मीर से बचाने के कई इनोवेटिव प्रयास देखे। यहाँ म्यूजिकल बाइक रैली जैसे कार्यक्रम हो रहे हैं, चंडीगढ़ में इस मैसेज को स्प्रेड करने के लिए लोकल क्लब्स को इससे जोड़ा गया है। वे इन्हें वादा क्लब्स कहते हैं। वादा यानी विक्ट्री अगेंस्ट ड्रग्स एब्यूज। पंजाब में कई स्पोर्ट्स ग्रुप्स भी बनाए गए हैं जो फिटनेस पर ध्यान देने और नशा मुक्ति के लिए अवेयरनेस कैंपेन चला रहे हैं। नशे के खिलाफ अभियान में युवाओं की बढ़ती भागीदारी बहुत उत्साह बढ़ाने वाली है। ये प्रयास भारत में नशे के खिलाफ अभियान को बहुत ताकत देते हैं। हमें देश की भावी पीढ़ियों को बचाना है तो उन्हें ड्रग्स से दूर रखना ही होगा। इसी सोच के साथ 15 अगस्त 2020 को नशा मुक्त भारत अभियान की शुरुआत की गई थी। इस अभियान से 11 करोड़ से ज्यादा लोगों को जोड़ा गया है। 2 हफ्ते पहले ही भारत ने ड्रग्स के खिलाफ बहुत बड़ी कार्रवाई की है। ड्रग्स की करीब 1.5 लाख किलो की खेप को जब्त करने के बाद उसे नष्ट कर दिया गया है। भारत ने 10 लाख किलो ड्रग्स को नष्ट करने का अनोखा रिकॉर्ड भी बनाया है। इन ड्रग्स की कीमत 12,000 करोड़ रुपए से भी ज्यादा थी। मैं उन सभी की सराहना करना चाहूंगा जो नशा मुक्ति के इस नेक अभियान में अपना योगदान दे रहे हैं। नशे की लत न सिर्फ परिवार बल्कि पूरे समाज के लिए बड़ी परेशानी बन जाती है। ऐसे में यह खतरा हमेशा कि हम सब एकजुट होकर इस दिशा में आगे बढ़े।
Now, I request every participant to actively participate in NMBA as a mass movement to achieve drug-free India. Please scan the QR code for updates, website, and social media handles. Thank you.
Thank you, Kristuraj. Your presentation gave a comprehensive highlight on the extent and reach of Nasha Mukt Bharat Abhiyan. I would now like to take the session forward by inviting our respected panelists for today's session. We would progress in an alphabetical order of the states from where the SLCA belongs. I would like to gently remind the panelists that the time allotted to each SLCA is 7 minutes, which might fall short to present the enormous amount of activities undertaken. Yet, I would request you to kindly stick to the time limit due to the time constraints of the online meeting. To begin with, we have with us Dr. Sandeep Hanse, Chief Functionary, Committee on Socio-Economic and Health Development, SLC Assam and Meghalaya, and Ms. Anamriya Barua, Project Coordinator of the SLCA Assam and Meghalaya. Since 2020, this SLCA has been working for capacity building training programs, awareness generation, and monitoring GIAs in the respective state. I would request our respected panelists to shed some light over the works done by their organization as SLCA.
Good morning, everyone, respected panelists and all the participants from the SLCA. I'm Dr. Sandeep Hanse. I'm the Chief Functionary for the State Level Coordinating Agency, Assam and Meghalaya. So, regarding the various update that has been going on throughout various years on the various activities under the NMBA. So, our coordinator, Ms. Anamriya Barua, she will present and she will highlight some of the activities that are going on and what are the innovative things that we have adopted as a part of the SLCA. So she will present right now.
Thank you, sir. So good morning, everyone. I'm Anamriya Barua. I'm the project coordinator of SLCA, Assam and Meghalaya. So starting off, I would like to say that NMBA has started in 2020 at 2020. So during that time, at first we had only 7 vulnerable districts in Assam and 4 vulnerable districts in Meghalaya. But now in NMBA 2.0, we have almost all the districts of Assam and Meghalaya. That is 35 districts of Assam and all the districts of Meghalaya. So as we are coordinating with the state government and the central government and with the district as well. So starting, I would like to share that we are working closely with the social justice and empowerment of government of Assam and with the social welfare department of Meghalaya. And with the states, we have associated with them in organizing the action plan and also by organizing capacity building training programs. Recently, we had a training program with doctors from Assam, which had a participant list of around 110 doctors from Assam have come, and we have trained them on handling the patients. And we are also moving forward to organize capacity building training program with the state government of Assam on for the media journalist people. And moreover, with the social justice empowerment of Assam, we have been working with them in drafting the standard operating procedure for running de-addiction centers, and now it has been out. And since 1st of August of this year, the SOP is being running in Assam and Meghalaya in Assam. And now coming to the district part, we are assisting the districts, which earlier, as I have mentioned, there were 7 districts and then 9, and then now we have all the 35 districts. So it is very new for all the districts of Assam and Meghalaya to know more about what is Nashamukh Bharat and what is going on in the society. So we are assisting them in carrying out the activities, and also we have started training the master volunteers. We recently had training for master volunteers for Golaghat, and we are upcoming with the training of master volunteers of Lokhimpur, and then we'll be training the master volunteers of Sonitpur and Jorhat along with the PNUs. And we have from our side, we have collaborated with 20 universities of Assam and more than 10 universities of Meghalaya, where we have organized anti-drug students forum, and we are helping those students forums in organizing trainings, in organizing awareness programs. And those student forums are also helping us during the awareness program. They come and help us in carrying out nukkad nataks and carrying out puppet shows. Moreover, that in context of community, if we say been we have been creating awareness in the community around 73 community, and we have also reached out to the panchayat level. We have where we have reached out to the villages, and we have reached out to the villages which are very interior parts. And in Assam, we are also targeting for the children for early prevention. So we have collaborated with the CPLIs of Assam, and also we are collaborating with the we are planning to collaborate with the CPLI of Meghalaya as well to work more on early prevention. And also we have started a signature program, signature campaign program, where we have reached out to till now at least 70,000 of children as well. I mean youths as well, along with the adults. And moreover, from the we have started a survey for to know about the extent of drug use amongst the children in Assam. So this is the first step we are taking up, and this step will be collaborated with the state government of Assam. And after this the state government of Assam survey, we will again carry on with Meghalaya as well. And from carrying out these different activities, we have got to learn that it is not an easy work to एक चुटकी में नहीं हो जाएगा to make nasha country nasha mukh. We will have to work together with all the community, with all the people, so that we can make our own state, our own district, our own village nasha mukh. Thank you.
Thank you, Assam SLCA. It is, we are amazed by listening to all the initiatives that you have taken up. So I would like to learn more about how you have done the interventions with panchayati level. Could you please elaborate on that?
Basically, in few of the districts like Jorhat and Golaghat, actually, recently we have guided the district administration that we have to reach the panchayat level. That is why from all the panchayat, actually, they have called the participants from many panchayat, and they have organized last month also we have organized in Jorhat like panchayat. We have trained up them, and now the district administration is looking forward so that in each and every panchayat there will be more number of awareness programs. So that particular Gaon Panchayat and Gaon Buddhas, means like the village headmans, has been called up, and this has been this initiative we are encouraging other district as well in Assam, because This was earlier ignored actually. Now we are mainly focusing the district, and we are focusing and we are giving them more emphasis that we have to carry out more in the panchayat level. It's still under the process. We have to reach many of the panchayat in other district as well. Yeah.
Also
Yes, sir,
partners
certainly.
from the Anganwadi as well. So they also have come and we have trained them as well.
Okay, so reaching to Panchayati level and Anganwadi and other such local communities would surely ensure to reaching out to the last people of the chain also. Thank you so much. We appreciate your words, sir and ma'am, and we are truly impressed by the wonderful initiatives and high activeness that SLCA of Assam and Meghalaya has showcased. Now, we are delighted to introduce Ms. Manisha Sharma, Director, Sankalp Sanskritik Samiti, SLCA Chhattisgarh, and Mr. Saurabh Tiwari, State Coordinator of the SLCA. To implement NMBA in its full spirit, the department has ensured a very well hand-holding of all the districts and various organizations. We would request the panelists to enlighten us with the steps taken by their organization as an SLCA to implement numerous activities for the cause of creating a substance use-free life. Over to you, Chhattisgarh SLCA.
Thank you so much. Good morning, everyone. As SLCA Chhattisgarh, along with the other projects like CPLI, ODIC, and IRCA, we are having few strategies to spread the message of Nashamukh Bharat Abhiyan. In this, we have taken up Nakti Sammanpur, the Nagar Panchayat, as our target area, because we have found a lot of addicts over there. So from past 5 years, the staff of all the project is going and staying in the Sammanpur for making it de-addicted. So Saurabh will be enlightening more. Now, from 10th August to 15th August, we are having various activities in Sammanpur, like pledge taking, workshops in community hotspot areas, Nukkad Natak, flash mobs, painting, rallies, everything. And along with that, we have also done advocacy with NSS state level. And now the entire NSS unit in our state had been online trained for it. And they are taking up in their villages and Gram Panchayat as Nashamukht Bharat Abhiyan. So a wider range to be covered by NSS. With nursing college also, we are doing the same. Along with this, we are online training the international students for de-addiction like Brazil and New Zealand. The language was a problem with Brazil, but there was the teacher who was helping them. They also wanted Brazil to us to go there and take a workshop, but that again is not possible. But online, as much as we are able to do, we are doing that. So now Saurabh will be presenting the rest of the strategies and plan. Thank you.
Good morning, everyone. My name is Saurabh Tiwari, and I'm the state coordinator for state level coordinating agency. While we are working on panchayat levels, we started to understand that camp is very good mode of working in the area. So we started to put together teams of integrated rehabilitation center for addicts, ODIC and CBPLIs to work together in the same village. So we conducted 3 days village camp in that area. First day we do slogan writings on wall, cleanliness of the village so that we can connect with the people. After that, we interact with women, men, and children separately so that we can understand their point of views, their problems, their their suggestions. And after that, we engage them in rally and do street play with them so that we can all get all connected with the people. After that, we saw there are several impacts that came after that camp. That is the first thing was the decreased usage of substance abuse in the festivals. During the festivals, we saw that people are using very much of the alcohols or any other substances during the festivals. So we started to give them suggestions about decreasing the usage of substance abuse. during the festivals, so that they implemented that, and we saw the change. The substance abuse decreasing is in the open areas. People used to do substance abuse in the open areas, so because of that, the children get inspired to use that. So we started to give them suggestions regarding this, and they implemented it. And they use a fine system also. So whoever get caught using substance abuse, so they do the fine thing. After that, the youngsters population is very much increases to do awareness in the area. Um, Women inspired to, because we suggest them, the women to inspire their husband, their brothers to go to seek help from de-addiction centers. So they started to do that, and the referrals are increasing. CVPLI is implemented in that area also. After that, we understand that youngsters are very important for Nasha Mukt Bharat Abhiyan to make it successful. So we reached National Service Scheme. What can be a better place than National Service Scheme to reach the youngsters? So we, because I was also a part of a National Service Scheme, so it get connected very easily. We reached the state coordinator for National Service Scheme. He releases a circular in the state, and most of the districts contacted us to do awareness and capacity building of their NSS volunteers. We are organizing constant awareness programs and training programs for NSS volunteers. These NSS volunteers do camps every year. One second. There is some issue. Yeah. So they organize camps every year and reaching different villages. More people are getting.
I think there is some technical glitch at the end of SLCA Chhattisgarh. No worries, we'll move ahead. We are grateful for the words, Saurav sir, and we would like to know more about your interventions in camps, which has made reduced use of the substance in public. Next, we have the SLCA of Gujarat, Nashabandi Mandal, which was registered in 1960. And since its inception, it has had one point agenda of Nashabandi, that is stopping addiction in Gujarat. From the SLCA, we have with us Mr. Jitendra Bhai N. Amin, Secretary, and on his behalf, there will be Mr. Tonmoy Chatterjee, State Coordinator of the SLCA. Sir, we request you to highlight the innovative actions undertaken by the SLCA Gujarat.
Good morning, everyone. Am I audible?
Sir,
Am I
yes.
audible? Yeah. First of all, I welcome all the representatives from MSJ and my SLCA friends. We are very closely working with government of Gujarat in NMBA matter, and nowadays Gujarat government is too active, and we are also offering our best supports. We are focusing on especially some innovative schemes like we catch the ABBP and NSUI, student unions, or catch the college students. Now, all over Gujarat, we are very easily reaching the college students. Like at the same time, NYK is also supporting us. We already conducted several trainings with the LGBT community of Gujarat. We have registered 5,600 LGBTs, and we are conducting online trainings and offline trainings. Basically, here I wish to mention one thing. Personally, I don't have so much belief on awareness program. We are focusing on capacity building, because if I don't know about drugs or something else, it is not possible to deliver in field. That's why we are very much keen to offer capacity building training program with the expert persons. Regarding to innovative things, we are reaching the village, remote area of villages. Like we contacted NABARD hopefully everyone know this name, NABARD. They formed farmers club. In every villages, there are lots of farmer clubs. They are doing agriculture activities. And we contacted that farmer club, and through farmers club, we are implementing the project, and we are trying to reach at the last part of the village. It is tough because more than 17,000 farmers club are in Gujarat and all are active. So, and Gujarat physically, it is a very vast area. So, we are still in a process along with ASHA workers. ASHA workers, they are doing very good job for health sectors, and it is easy to contact them in district level or taluka level, and they already have some basic knowledge about medical. So ASHA worker are helping us like anything, and especially from last Monday we have a big meeting now with the Gujarat government high officials. Now perhaps you know that the border area of Gujarat is facing big problem about the carrier of drugs. So from coming months, we are focusing 7 districts of Gujarat, border area, water, sea is there. So this about us. Anything you can ask. Anything you can ask for more clarity.
Yeah, thank you, sir. So you will elaborated on border areas and how you have worked with community, with organizations such as ASHA workers. Sir, we would like to know how collaborating with these organizations has helped you in reaching out to the vulnerable section of the community. Could you please brief it?
Yes. Basically, it is not possible for a SLCA to reach the last part of the village members. Those are general people. Those are agriculture based. So through Farmers Club, it is very easy nowadays. We are contacting Farmers Club and we are offering them capacity building training programs. Another 2 things, earlier I also mentioned that we are focusing on 2 things, that is skill development, life skill development through our Navchetana module. Because I have a personal belief that Navchetana module is so good for the student and the children, and that life skill development is a very essential part of this project. If we can develop this concept, then 50% problem will automatically remove.
Yes, sir, certainly. Life skill development through Navchetna modules would certainly help. This is a good initiative, and it's good to see how these resources are being utilized by the SLCA.
Yes, thank you, ma'am. Thank you.
Thank
Life
you.
skill. Okay.
Thank you for your remarks, sir. We are astonished by the incredible programs SLCA Gujarat has implemented.
Thank you, ma'am.
Moving forward, I would like to inform our co-panelists and audience that our next panelist is Mr. Sandeep Parmar, Executive Director, Gunjan Organization for Community Development, SLCA Himachal Pradesh and Chandigarh. The Gunjan organization has been actively working in the field by carrying out various training programs and by ensuring participation from various target groups such as students, teachers, youths, Mahila bundles, community-based organizations, and Panchayati Raj institutions. I would like to invite you, sir, to bring our attention to the best practices undertaken by the SLCA Himachal Pradesh and Chandigarh.
Good morning, Kritika and all my fellow colleagues. In fact, we are working with the scheme of prevention of alcoholism and substance abuse since 2003. And this time, I'm here to talk about the special program which we have conducted in the last year, and we have adopted. Am I audible to all?
Yes, sir, you are. You're audible.
Because on my screen there are different set of data is here, so I don't know what exactly this is. So like which is disturbing me. we SLCA adopted one district of Himachal Pradesh, which is bordering district Una, and it's a disturbed district by the substance abuse among different communities, right from students to adults in the past few years, because it has a great impact of Punjab drug problem, and it shares the long boundaries with the Punjab. So, we are also implementing one IRCA in this district, and we were called by the local administration to conceptualize one primary prevention program, which is covering right from the household to the school level. So, on the primary preventions aspects. So, we designed a program, Nasha Mukt Una, though this district was not covered under the Nasha Mukt Bharat program and the special district category. So, like a district administration, they made the provisions to for this program, and roughly they spent about 50 lakhs on this program in 1 year. So our team designed this program on the for primary prevention program, where the stakeholders were the parents, right from parents, households, and PRIs on different levels, which are the line agencies and line departments are. So the beautiful thing is, first we felt to capacitize the different line agencies, about 5,000 people, functionaries from different agencies. For example, right from ASHA worker to the mentor teachers. We facilitate trainings, we design the trainings for them, and we conduct trainings in participation with district administration, so that this program can go in a standardized way to everyone. Number two, this program made a reach about 26,000 students in 287 schools across the district, from 6th class to 12th standard class, on different life skills modules. And specifically, I would mention the Nav Chetna module to the every school. And another innovative intervention was the Har Ghar Dastak Abhiyan. So this program also reached with the message of district administration to every household. Roughly 1,10,000 households were touched in participation with district administration in 8 months. So this was the achievement of this program, and there were so many activities conducted to engage the youth, to engage the student in healthy living practices, in different lifestyle practices, and how to use the internet and this communication channels, which is helpful in their studies and in their life making, instead of like disturbing them or taking them to a different direction. Another one baseline survey was also conducted, which was also shared with the ministry and district, state level agencies who are responsible to implement some the line programs for the district. So, some alarming figures were there, where the vulnerable community was really moving towards the substance abuse problems, and which can cause the addictions in future for them. So these were the innovative program, the interventions conducted in the district, and the impact of this. When NCPCR team was have visited this district, and they found this program is like a very it contributed in a very good way to the society. So this program was also awarded last year with the national award by Ministry of Home Affairs. So district administration, they received this award. Every social media Nasha Mukt platform, Nasha Mukt Una Bharat Una program was participated on every social media platforms like YouTube, different contest was created, and it's a large participation of larger community. And also, this is one side of this program, preventions and the treatment facilities, because district Una has a one treatment facilities. So this was also realized that we also need to initiate treatment facilities on OPD levels. So in the entire district, there were the medical officers was of CHC level was also trained. About 30 medical officers and the nurses were trained by in coordination with the NDDTC, and these all clinics are operational in the district now. So impact is the people who were facing the troubles, they started accessing the treatment services. The people who were vulnerable, they were empowered with the information. The parents who were having less information about the substance abuse or the vulnerability factors, they were also empowered. The PRIs who were also empowered with the information how to deal with the situations and where to refer the things. The referral services is uptaking now in the district, though this program was only for the 1 year, but we are seeing the impacts of this program, that services. For example, we are also implementing a program for children, a treatment program for children. So there are referrals from the panchayat level to that center as well. So this is the program, and the state level, how this program is now state is taking. So state has considered this program for the applications in the entire districts of the Himachal Pradesh. So that's all. This is the innovative program we have done in the last financial year under our SLCA interventions. So if any questions, we are ready to.
Yes, sir. Thank you. These interventions would certainly have given a lot of learnings to move ahead with a lot of planning. So, sir, we would specifically like to know very in brief about your Har Ghar Dastak program. Since the time has exhausted, I would request you to please mention about it only in brief.
Yeah. The Har Ghar Dastak Abhiyan was kind of like a letter was drafted from the office of Deputy Commissioner, where he has mentioned about the objectives of the program, the role of panchayats, role of parents, role of senior citizens in the village level. And thus that printed letter and one sticker was also published. You can also look into our social media handles, YouTube and Twitter as well, where some little of every village panchayat, we have created the reels and videos and uploaded and shared with the ministry as well. So that was a team was created in the leadership of sub-divisional magistrates on the SDM subdivision level, because SDM was heading the committee. We have created that structure. SDM was heading the committee on the subdivision level, and they are going with the team they select the panchayat, they select the pradhans, they make the local level team, and they visit every household, and they were spreading the message of district administration to every household. They put the sticker, they are distributing the pamphlets. So in that way, the message was going, traveling across the communities in the entire district. The objective was that. And the communities was also ensuring their participation. For example, the participation of local community-based organization, for example, Mahila Mandal, Yuvak Mandal, they were also going together with that team to visit the households.
Yes, sir. So this Har Ghar Dastak Abhiyan, as the name suggests, would certainly have ensured reaching out to every doors.
Yeah.
We are
This program reached about 110,000 households in 8 months when this Har Dastak Abhiyan was launched in the district.
This is great, sir. We are thankful for your presentation and we are delighted to hear about the fantastic endeavors of the SLCA Himachal Pradesh and Chandigarh.
Thank you so much.
Proceeding-
Thank you.
Proceeding ahead, from Kerala, we have with us Mr. Giju Varghese, Director and Secretary, Changanacheri Social Service Society, SLCA Kerala. The SLCA has dedicatedly worked by engaging in a lot of awareness programs every year in collaboration with many NGOs and departments. I would request Mr. Varghese sir to take over and share the best practices of the SLCA of Kerala with our participants and audience of the webinar.
Thank you, madam. Good morning to all. Changanasheri Social Service Society, Charles SLCA Kerala has initiated this intervention in drug abuse prevention from 1989 onwards. We had started it with just one counseling center, then it was turned into IRCA. Then later on, the SLC, it was an RRTC, then it has become SLCA. We had so many, we plan and implement many awareness programs, like community outreach awareness programs, whereas we work with workshops, rallies, then the campaigns in the even almost every year we do the signature campaign in the public places and also in school colleges. And also we have started to form the Nasham clubs in through the colleges and the schools. Also, many of the programs we have we engage people, students, the children in activities like sports, music, and arts, so that they may be engaged in the extra times will be engaged in such kind of activities. Also, for from the technology part, the online programs were conducted for the different categories of people, youth, children, and even the people who are the white-collar job peoples. And for about the children, while we give them the awareness programs, we also give the life skills for the children, and also we try to get the youth and the adults with skill training programs like carpentry, tailoring, and also the digital literacy and all. So that way we promote people like that. Especially, I am very happy to tell you that during this anti-narcotic day in 2024, June 26, within 1 month, we could conduct 101 awareness programs within 1 month with the help of our volunteers and then different groups. And it was a big thing we could do. During this time, in 3 districts, we had gone with campaigning with the announcement and also the rallies. So that way we could cover almost the half part of Kottayam district, and Pathanamthitta district, and also Alappuzha district. Also, we conduct many of the, from the grassroots level, we conduct the awareness programs and also the training programs, where from SHG, they are the grassroots root people. We involve them in the SHG is like in Kerala we have Kudumbasri, and also with the Kudumbasri and then the self-help group which we have our own chances formed the SHG. So from the SHG onwards, we have we try to create awareness on the drug prevention and also encourage the community members to report the drug related activities to the concerned authorities through anonymous reporting system. Also, we have different programs like especially this high risk areas. Now in Kerala, we have this coastal area. So almost all these coastal areas we meet our fishermen and we give awareness to them. And also with regards to the situation in Kerala, our study is that the children are more involved in this drug use. But unfortunately, in the whole of India, we have very few treatment center or the rehabilitation center for children who are addicted in with drugs, and also very few facilities are being given for this kind of treatment centers. But in Kerala, we have chance the SLCA Kerala, the organizer, the NGO has started a treatment center for the children below 18 years. So that way also we encourage the parents and the school authorities by giving awareness to them to send these children to the de-addiction centers or the ERCAs of these children. So that way, many programs are being conducted and actively involved in the NMBA program through all our initiatives. And also, we collaborate with many NGOs, the institutions, colleges, schools, and also the Panchayati Raj. And also in a Grama Sabha, we have got Grama Sabha here. In a Grama Sabha and all, we go and talk to people about the continuous growing of the continuous growth of this children coming into this drug use. So that way, many of the programs are being undertaken by SLCA Kerala with all the social justice department of different districts and the state as a whole.
Sir, in very brief, could you please tell us a little about how Nasha Mukti clubs have helped in this intervention, which you mentioned?
Yeah, in schools now, we have started with just one school. 1 week we had a intensive awareness program there in a particular school called Kainadi, near in between Kottayam and Alappuzha, the border of Alappuzha and Kottayam. There 1 week intervention, the social workers, the counselors, 1 week they had the counseling with the children, and there we have already kept a board like this, the drug-free campus. So that way we are trying to get into the different campus of colleges and schools to make it drug-free. So there the children, they have their own a small group. They will monitor and they will volunteer to fight against this drug use.
Thank you, sir. Schools are certainly very important to take up in this issue. So it's great to see that these interventions are up. It is wonderful to see how the SLCA of Kerala has dedicatedly taken up the activities by owning it to bring a change in the society. Thank you. From the capital of the country, New Delhi, we have with us Dr. Rajesh Kumar, Executive Director, Society for Promotion of Youth and Masses, SLCA Delhi. SPYM Delhi has made significant contributions through its various programs aimed at rehabilitation, prevention, and education, along with imparting capacity building training to various NGOs and GIAs working for the cause. I would request Dr. Rajesh Kumar to take us through the best practices being organized by the SLCA Delhi.
Thank you, ma'am. Let me first greet all of us a happy Independence Day. And it's a great opportunity for SPYM because we have been working for last 40 years. And what we have realized, when we started working in 84, 85, the average age of drug user was in 20s, not in 10s or in teen. So in last almost 10 to 15 years, what we have done, we have developed for ministry and other organizations various models. And since the topic of today's discussion is innovation in action strategies adopted. So I'm grateful to some of our SLCA members, those who have used the word CPLI or Navchetna. So what we have done in SPYM, that's our strength. We have been working, developing models, and if the model is useful, working, then we request Government of India to adopt it. For example, when we started working on counseling center, I'm talking about 85, 86. That time it was Ministry of Welfare, they adopted it. So I will restrict to when we became RRTC and SLCA. So what we have done, we have divided the entire population in 3 or 4 categories. Number one, of course, the children, those who are below 18. For them, Navchetna has been developed over a period of time, and the ministry, we would like to compliment ministry to take this in a mission mode, and it is doing very well. So Navchetna was developed by SPYM for the ministry. Then CPLI, community-based peer-led intervention. Just for the information, those who are not aware, we have been running 3 treatment centers for the children. One for the children, those who are in conflict with law, those who have committed crime. Then one center for the girls, those who have been using substances. And the third is the children, those who have not not committed crime, but they are drug users. So on the basis of these 3 centers learning, the CPLI was developed. So this is also being now, this has been adopted by Government of India. So this is again a very heartening for us that we are in a position to develop something which is of much use for the nation. Of course, for the young population, we are still in a developing phase. Of course, the ODIC, Outreach and Dropping Center, which we initiated in 2010-11, now that has also been adopted, because the whole concept of ODIC is very simple: safe space for the young population, those who cannot go to school, cannot go to the workplace, and cannot remain at home. And the large population, which is finding it very challenging for them, the ODIC, the concept was developed, and again thanks to Government of India, Ministry of Social Justice for adopting this. Now we are working on two different models. One model is for the rural population. In rural population is a hybrid where we have brought the Navchetna, we have brought CPLI, we have brought frontline workers, and we have developed the models for the frontline workers training. It's a one-day training. And with the help of Ministry of Panchayati Raj, we have also developed a module for Panchayati Raj elected members. So right now it is in testing phase. We have in English and Hindi. So, since it is all innovative and a strategy, that's why I'm sharing all this. I'm not going to detail how many people we have covered. So these are something. And one more model we are trying to develop, that is in Delhi, that will be the slum based. In slum, how the sports could be utilized, how music could be utilized, how dance could be utilized. So this is again on drawing board, and we hope that by end of next year, we should be able to give the Government of India a robust model which can be implemented in different parts of the country. How much time I have? So accordingly, because I can speak for hours. How much time I have?
Sir, as per 7 minutes, it's only 3 minutes left, but we can give you 5 minutes. Please take your time.
Thank you. Thank you for the opportunity. So then what we have also done, there are populations which are not visible. For example, homeless. For example, beggars. For example, destitutes. So when Delhi being a large city and the population is more than 20 million. So there's a large population which is based in Delhi. They are homeless, and so we have started a treatment center exclusively for homeless, and where we have a partnership with All India Institute of Medical Sciences, NDDTC. And again, this is all what we have done over a period of time. We have developed, and in fact, this center has been visited by different senior people all over the world. For example, White House, the entire team came because for them they call it unhoused people, and we call it homeless. So, the whole program is that we bring people from the street. We have a rescue van which goes in the evening, whether it is a summer or it is a winter. We don't do it during the monsoon or in the month of April. So we send our vehicles. We call it a rescue van. They go to the streets, especially where the congregation of homeless and drug users are there. We bring them to our Kotla Mubarakpur center. We don't ask any question. I said, you just stabilize yourself. Then if they are comfortable, we link them with the AIMS center, where the mental health assessment is taken or done by the AIMS. Then they are brought on the oral substitution therapy. And if they are not comfortable on oral substitution therapy, then we have linked them with the SQIM's targeted intervention, which has been supported by NACO. Then on the second floor, we have a long-term rehabilitation, and then they are linked with the various skill development programs. And when we say skill development program, which is usable and viable for the people, those who are has been living on the street. The reason is we train them on plumbing or electrician. Usually they will be never allowed to go in anyone's house. So it is more like a guard or safai karmchari or housekeeping. So these are the things we have been. So that is another unique thing. We are also working with Tihar prison in Delhi. So this is another model we have developed. Our big challenge is how to train large number of people, those who are not working with SLCA, but they are working with other organizations. So we have tied up with the international organization. I had requested for for the PowerPoint. I'm sure you can forward it later. So I have given a link, and in that link there are 8 modules. It's called Universal Treatment Curriculum. Now these 8 modules, if any worker completes, then they will be certified as a global trainer. So this is free. The moment they complete one portion of one chapter, instantly they will get a certificate. And if they complete all 8, generally it takes 3 to 6 months. Some people have completed even within a month also. So that we have tied up with the international organization. And we are also requesting them to, why not you translate this in at least 3-4 Indian languages. So that negotiation is going on. Now, another 2 very important challenge. The challenge is reducing stigma and discrimination. See, if a young child is using drug, the family will never like to know the world that my son, my daughter is using drug. So we have started working on it, and for which another model we are trying to develop, and we have shared this information with the ministry. But currently, I'm not in a position to share more details about it. And once it is ready, then we will share. So stigma reducing is everyone's responsibility. And if the stigma is reduced, then automatically the discrimination will be less, and more people will be comfortable seeking health services or drug treatment services comfortably. The last is we call it an alternate to incarceration, for which we are now working with the Honorable High Court of Delhi. We are also we have engaging other district courts, where the people, those who have committed a smaller crime, instead of sending them to Tihar jail, because Tihar jail is the only jail for Delhi people. So instead of sending them to Tihar jail, send them to the treatment program. And we have already started receiving it, but still we have miles and miles to go, because on an average, what we have realized that we have 11 districts and 6 court complexes. Every year, around 20 to 30,000 people, those who are drug users and they have committed a small crime, they are sent to prison. And Tihar prison has its own limitation. This prison was made for 8 to 10,000. More than 20,000 inmates are there. So we have to also ensure that the criminal justice system is lessened with these type of borders, and they are treated. And once they are treated, they will take care of their family. They will take care of their children. They will be they will be productive for the country. They will be productive for the state. Apart from this, and that's my last. We are also working on the chemical drugs, because what we have realized over 2-3 years, suddenly the chemical drug has started flooding. I don't know about other part of the country, but certainly I know about the Kerala. I know some other states, and of course Delhi, Noida, Ghaziabad, Gurgaon, where the chemical drug is not only it has not surfaced, it is in a big way. And they have also started manufacturing locally. Earlier, it used to come from different parts of the world. Now it is being manufactured locally. Of course, we get the cookers from Mexico. We get the cooker. Cooker is the person who makes it, who converts chemical into the chemical drug. So these are the things what SPYM, SLCA Delhi has been working on it. And I'll close here. If you have any question, please ask.
Yes, thank you, sir. It is amazing to see the activeness that SPYM Delhi has always showed for this intervention. Sir, although you have elaborated much already about the coordination with the jail thing, but we would like to know a little more about it.
Okay.
But very briefly, sir. Yeah.
Okay, so what we are doing, see, the prison is the best place on earth to treat people, those who are drug user and in prison. The reason is food is free, shelter, of course, the shelter is free, medical services are free. What we need is, I says, is only 25% of the cost usually we incur on any IRCA. So there, what we have provided therapist, we have provided counselor, we have provided social worker, and backward forward linkages have been established. Those who have already arrived in the prison, the day they arrive in the prison, from same day our program starts. So some people, they get they get their bail in 5 days time, 3 days time. Some they get bail after 2 years. So those who get the bail in a shorter period, we have another dedicated treatment center for them that is near Dakshinpuri. So we provide them the phone number, we provide them the address, and they all arrive there. So usually they do not have money to come. So the moment they come, we provide them even the auto fare, and usually they are they are released from the prison around 8:30, 9 o'clock in the evening. So generally our people will inform that particular center, SPOM center, that someone, 2 or 3% will come. Please accommodate them. Please keep food for them. And then if they require any other service, for example, if they want to be linked with hepatitis C treatment program. In fact, just for your information, what we have done, we have partnered with the international organization, and now hepatitis C, the testing kit has been. It was already there. We have tested it. It is a saliva based. So we link them with the hepatitis C. If they require any other legal services, we link them with the legal services. If they require HIV treatment or ART services, so all these linkages are established by this Dakshinpuri Center. So this is a large program, and currently we are working in prison number 5, which is for inmates from age 18 to 21.
Okay, sir, that is great. Thank you so much for sharing your inputs. And we are in awe of the remarkable initiatives SLCA Delhi has conducted. Since Chhattisgarh got disconnected in between, I would request the representative to conclude by also slightly highlighting about the camps they mentioned which help reduction of substance use in public gatherings. Sir, I would request you to kindly wrap up within 2 minutes, please, since we are already running out of time.
Yeah, thank you very much, ma'am. Am I audible to you?
Yes, you are audible. Please go ahead.
There was some problems with Wi-Fi. So we were in National Service Scheme. The change that we saw with that is that capacity building, due to capacity building, the volunteers are reaching their villages, and they are awareing other peoples about Nasham Bharat Abhiyan. So we don't, as SSCA, we don't have to be there, and we have created some sort of volunteers for that. The people belongs from these villages are reaching de-addiction centers, ODIC, CBPLI. So the referrals are increasing of these villages which are untouched before. So other is that these volunteers are eager to become, after they cover their courses, they want to become the national Nasha Mukht Bharat Abhiyan's volunteers in the future. So it is a positive change that we have saw with this. After that, we are working with health service providers also. From IRCA, ODIC, and CBPLA, we get information that most of the people who come to these centers, they are taking 15, 16 days of treatment in hospitals. At that time, they didn't know about the rehabilitation programs, which are free in the state. So what we does is that we reach these health service providers, reaching nursing colleges of different districts. We start to give them capacity building programs, and due to this the referrals from these hospitals and from these health centers are increased in ODIC, CBPLI, CBPLI and ODIC and IRCAS. And most of the positive things that we have saw is that they are also referring others people who belong from their own places, from their own homes, and from their own community. So this was the also the positive benefit that we have saw with helping with health service providers. And we have we have organized two international awareness programs with Buri district, Sao Paulo, Brazil, and one with Inver Kargil, New Zealand, Raipur. During this program, we shared information about Nasha Mukht Bharat Abhiyan, and they give us some good suggestions regarding working in the future in our areas, so that we can give better results to ministry. We have also offering foreign students some sort of internship programs, so that they can learn about this programs that we are running, ODIC, CVPLI, SLCAs, and many more. So with this information, they will able to help their community when they reach their home. And there are several other international awareness programs are also in discussion, because we have worked Brazil and New Zealand. They are sharing this information to other communities and other colleges, so that we are hopeful that we will able to organize this awareness program in the future as well. There are some key things that I want to share is that we have signed an MOU with Rawatpura Sarkar, Raipur. So whenever any new students, batches of students reach these colleges, they will share their information to us, and we will organize awareness programs. And because most of the people who reach this their new they see changes in their life when they reach the colleges, so they are become vulnerable. So we think that giving them information about this rehabilitation programs and information about the harmful impact of drugs, we will be able to reach much more people. We are working with Chhattisgarh State Police Department under Nijab programs, organizing different awareness programs in different areas, different communities. We are working with social welfare departments as well under Nasha Mukht Bharat Abhiyan. We are organizing awareness programs in tribal hostels, because they are away from their home, they are away from their parents. We think that it is very much helpful for them to understand the harmful impact of drugs, and they need to work on their studies and work on their professions. We are also organizing transgender shelter homes awareness programs, which is available in Raipur as well under Garima Grah program. We are organizing awareness programs in observation homes, so that the children or the youngsters who go into the community, they will take a better step in the future. We are working with self-help groups in the Chhattisgarh district, so that we can reach much more community, much more people in the area. Internship programs are also offering by SLCA, so that students and youngsters can learn about ODIC, CBPLI, and how this community programs and rehabilitation programs are working.
Thank you, sir. We are grateful for you to share all these
Yeah,
initiatives with us.
Thank you, ma'am. Thank you for
We
giving
will
us
now
opportunity. Thank you.
conclude, and we are amazed by the outstanding activities introduced by the SLCA of Chhattisgarh. It is truly inspiring to witness the dedication of all the SLCAs toward the shared objective of making India drug-free. The unwavering efforts of the SLCAs have been enlightening for us and our audience, as we have gained insight into the remarkable initiatives and commendable work being undertaken to discourage substance use. I am pleased to share that numerous such activities are being conducted nationwide by SLCAs across various states. I would like to take this opportunity to commend the efforts of all other state level coordinating agencies for their steadfast commitment to this initiative. Together, as a united team, we can combat substance use and realize the theme of the Nasha Mukt Bharat Abhiyan for the 78th Independence Day, that is, Viksit Bharat Ka Mantra, Bharat Ho Nashe Se Swatantra. We would be sharing the presentation shared by Delhi SPYM in the chat box and with the panelists also. I now request everyone to turn on their cameras for a group photograph. Sandeep sir from Gunjan organization. Sir,
So
please turn
sorry,
on.
my camera is not working. I don't know, it's locked.
Okay.
This is the message I'm getting. Make sure camera is not found.
It's okay,
So
sir.
you can please go ahead. So sorry.
Yeah. Okay, thank you. We express our heartfelt gratitude to the panelists for taking out their time from their busy schedules. Your active participation and guidance continually inspire all those you engage with in the noble cause of serving the nation. I would also like to thank our team for their constant support and coordination in organizing the event. Senior Program Officers Dr. Sijo George, Ms. Risha Nusrat, and Anushka Gupta, along with my fellow PMU state coordinators, Mr. Kristuraj, Ms. Deepti, Ms. Jaya Gola, Ms. Pragjyotika Meena, and other fellow coordinators of the respective state. A big thanks to all our viewers for joining us today. Stay connected with the Nasha Mukt Bharat Abhiyan and continue to be ambassadors for a drug-free life. Let us inspire others through our actions and our commitment to a healthier future. We encourage all of you to connect with us on social media. Links to our NMBA social media platforms are provided in the chat box. Thank you once again and have a wonderful day ahead.
Thank you, ma'am.
Thank you.
Thank you.
Thank
Thank
you,
you very much,
everyone.
ma'am.